Hello, my name is Beezy Wu, and I work at the Annie E. Casey Foundation. We're here to talk about equitable implementation through the example of Bienvenido, as described in the SSIR article, Community-Defined Evidence as a Framework for Equitable Implementation. The article describes how the Bienvenido program engages Latino communities to better understand their mental health concerns and to develop a program that meets their needs. I'm joined by two of the article's co-authors, Gilberto Perez Jr. and Linda Callejas. Gilberto, would you like to introduce yourself?
Hello, Betsy. Thank you. Yes, my name is Gilberto Perez Jr., and I serve as the President and CEO of Bienvenido Community Solutions, LLC.
And Linda.
Hi, Betsy. I'm Linda Callejas. I am a research assistant professor at the University of South Florida. And I'd also like to recognize our co-author, Francisco Limon, who is the Chief Integrated Services Officer at Greene County Healthcare in North Carolina.
Thank you both so much. Gilberto, very briefly, could you tell me about the Bienvenido program and what it's designed to do?
The Bienvenido program, Betsy, is a mental health promotion intervention that was developed a number of years ago to look at the mental health needs of Latinx immigrants within this Northeast Indiana region. And we spent time with immigrants, Latinx immigrants, looking at, from a strength-based perspective, how they are adjusting to life in a new country and how their mental health could potentially be impacted by having transitioned and migrated from one country to another, as well as looking at some potential trauma that may have been experienced, but also trying to enhance the quality of life of that immigrant who is arriving in their new community and finding ways how they might feel like they belong in that community and they are engaging in good mental health, positive mental health for who they are and how they are in their community.
Thank you. And Linda, given what Gilberto has just described, what core elements of equitable implementation helped put this program into action?
Well, Betsy, as we discuss in our paper, the elements that I would identify would be collectivism, cultivation of social support networks among participants or service recipients, and community integration, which I would identify as the most important element. Here, integrating community residents as key partners in the development and implementation is probably one of the most important factors factors related to the success of Bienvenido. The relevance of this program has to do with a lot of the work that Gilberto and others put into engaging with local residents in the development process. And then we see throughout the implementation of the Bienvenido program, how that work continues to inform the implementation as well as replication in the future. So it's a really, really critical piece.
Gilberto, how did members of the community define success? And how do you think that helped the program succeed?
Well, I think one of the fascinating things that happened as people began to participate in the program is that as time went on, they began to know where to access resources, and more specifically, where to access mental health resources for participants to engage in conversation about their migration experience, but also about how they can connect to community and then to be more involved in their community, because part of the sessions are to have them think about ways that they can be connected. I think how we measured success within the organization is that we began to see people moving from the mental health promotion in community to the actual mental health treatment center. So now you had people who were involved in a community environment, and now we're also involved in a community mental health treatment center, which again helped people understand mental health systems, and then it helped increase services to individuals within the mental health center in our community.
Linda, what were some benefits from your perspective?
I think one of the key things that we saw with Bienvenido is that, and I think with most community-defined evidence practices developed with this framework in mind, is hearing from voices that we don't typically hear from and have those be engaged within an implementation process, right? Within the process of developing an intervention, and not just with, with our expertise as professionals, but really getting those experiences and needs, wants from the people that we're expecting to use particular interventions in community. And then I think the other thing would be from the vantage point of, like as a researcher thinking about this intervention, this program, is how we can use indicators beyond outcomes at the individual level, right? That are important and relevant when we think about what we can do to reduce disparities and increase equity in communities that are traditionally underserved.
I'd like to open this up to both of you to talk about the hardest part, the challenges that we know can come with equitable implementation, and specifically creating and using community-defined evidence. We know this is not easy work, and we're interested in what you learned. What were the barriers you faced, and how did you deal with them?
Easy, that's an excellent question. I think I would frame it in sort of the barriers to say, I think we were really struggling initially in terms of how do we have people who perhaps have not openly discussed issues of mental health. So there is a sense of stigma and a taboo and almost a fear of talking about that migration experience. And it was the barrier of not having access to individuals to be able to talk about that. So we were really trying to think about creatively of how do we engage people in conversation. And we really had to sort of think about the barrier of allowing another organization to allow a mental health center enter into their space for offering mental health promotion. Organizations sometimes can sort of work sort of siloed and may not have the best partnerships. And so we were really trying to establish connections. And so we did with the Literacy Center, where we took mental health promotion into a literacy center. It's a place where individuals are already in a learning mode. They're excited about learning. They want to be accepted. They want to be in community. So the barrier was, how do you access the people? Second barrier is how to get an organization to partner with you. And I think the third barrier is really inviting people to participate in creating the conversation about mental health. And we actually did that by saying to them, we're excited about being here at the Literacy Center because you're learning. And we want to make sure that you participate with us in creating those questions that we should be asking one another about mental health, and ensuring that we build trust amongst each other. And so how do we remove the barrier of distrust with an organization, and knowing that we could do that if we were in relationship with you over time.
So those are such critically important points, Gilberto. And I think the only thing that I would add, because I think Gilberto gives such a great perspective of the on-the-ground barriers, is when we think about implementation, science, and what we can learn from this as researchers and broader practitioners in the field, is that this idea of where expertise lies in communities, and being able to add that to our toolbox with regards to interventions, how interventions are evaluated, how they are, how we judge them or put them in these clearinghouses. We also need to think about these very important practical and applied matters with regards to how communities respond and what it is that they need based on their own on their own words, experiences, and in their own terms. So I think that's still kind of a barrier, even though we're doing, I think, groundbreaking work here to continue to carry that message forward.
Well, I have one more question for both of you. If you could give one piece of advice to a group that wanted to do something similar, what would that be? Gilberto, why don't you go first?
BG, I think if I were to offer that advice to a community organization or a group, I would say communities have expertise and they have valuable information, and they are valuable partners in the process of creating engagement with one another. It's important to them because it's important and it's relevant for them. And so therefore, work with communities to do work with them, not for them.
And Linda, what is one thing you would want someone in your position to know?
I'm just going to echo Gilberto's response, which is, I think, really critical. We oftentimes, when we think about, let's say, disparities, or when we talk about traditionally underserved communities, where we hear talk of, hard to reach populations. Those populations are often hard to reach because those of us out here may not have made those inroads or relationships. And so if we are in those positions, we need to seek out folks like Gilberto or others who are embedded in the community, who have those relationships, who can help us to make those inroads. Because otherwise we are still working from a framework of coming outside with our expertise and imposing on communities.
Thank you both. We really appreciate all your insights.